Today we're going to see how medical care is part of the public health system. We've learned that prevention of illness and injury is central to public health. However, at one time or another, we will all need a doctor, hospital or clinic, and medication. Because medical care is so expensive and most Americans can't afford to pay out of pocket, they purchase health insurance. A majority of people have private insurance through an employer. Individuals who don't get an employer health benefit often choose to buy policies from an insurance company directly. For vulnerable populations that can't afford to buy insurance on their own, the government pitches in. This is referred to as public insurance. For example, in 1965, Congress passed the Medicare Act, which covers people 65 years and older in order to ensure that retired persons on a fixed income will be able to afford health services, especially with a constantly rising cost of living. Also in 1965, Congress passed the Medicaid Act, which covers persons with severe disabilities and poor people who qualify for aid, that is, those who meet a certain income eligibility requirement. In 1997, Congress passed CHIP, the Children's Health Insurance Program, that covers uninsured children up to age 19 whose parents are poor but earn too much money to qualify for Medicaid. The federal Medicaid and CHIP programs are administered by the states, which have to guarantee that the targeted groups are covered. Together, Medicaid and CHIP have given healthcare access to 60 million people who would not otherwise have had coverage. Though the Medicaid insured receive access to care, they might not receive the same level of care as those who are privately insured. In addition, they're generally treated in clinics, since private practices severely limit the number of Medicaid patients they take. As you can see, the American healthcare system is a patchwork of coverage. It leaves more than 50 million people uninsured and millions of others underinsured. It's not that Congress hasn't been concerned. A look back at the 20th century shows repeated attempts to enact universal health insurance. That is, insurance for everybody. But all of the proposals have been defeated. Over and over again, this country has shown it lacks the political will to make this happen. Opponents have used scare tactics by labeling universal health care a form of socialism that rations services. They claim that taxes to pay for it will hit the ceiling. And they attack the needy as lazy, unemployed slackers living off the public till. Supporters of universal health care should emphasize this sad and contradictory fact. Americans are entitled to free public education, that is, education for everybody, intended to level the playing field and give everyone an equal opportunity to succeed. Yet Americans are not entitled to universal health care, which also gives everyone an equal opportunity to succeed. With regard to health care, the U.S. is much less equitable than most other industrialized nations, several of which have universal health care. Too many Americans fall between the cracks in our system. Many work hard and earn too much money to be covered by government insurance, yet too little to afford private insurance. Many don't know they're eligible for Medicaid or don't know how to navigate the system to find an insurance policy that suits them. And many, including immigrants and the homeless, just don't care because they have more pressing social or mental difficulties.